Good afternoon, everyone. Before diving into the data, I want to give a quick shout out to the entire data team across our COVID response and at the Rhode Island Department of Health. You can only imagine how much work goes into analyzing and validating data when you're doing more than 20,000 tests a day and the number of 10,000 plus vaccinations a day. Our data and analytics team gets it done every day, and they have since the very beginning. They are the heartbeat of our response, and wanted to take a moment to say thank you. In terms of our numbers for today, we have 110 people currently hospitalized with COVID-19. Our average for the week is 113 people, which is down from 142 the previous week. And it is way down from the more than 500 we saw at points in December. Very thankfully, our fatality numbers also continue to trend in the right direction. We're down 86% from our peak. However, we do sadly have one additional COVID-19 fatality to report today. In terms of cases, we have 441 new cases to report, and that's out of 20,634 tests. That is a percent positivity of 2.1%. This is the 6th straight week that we have been right around that 2% number, 4% positive. A 2% positivity number is good. It's less than half the 5% target that is oftentimes set out, and it's well below the numbers we were seeing just 3 months ago. However, the stability in that number does tell us something about the landscape of COVID-19 in Rhode Island right now, and I want to spend a moment to really explain that and echo what the governor shared about continuing to be disciplined. We are vaccinating more and more people every day, which I will get into more detail in shortly. This means that the pool of people who are susceptible to contracting COVID-19, the coronavirus that causes it, that pool who are susceptible is becoming smaller and smaller every day. However, our percent positive number has continued to stay steady. It has plateaued. It hasn't decreased to the same extent as of yet. What that suggests for us is that there is a significant presence of the more contagious strain of COVID-19 in Rhode Island. I talked last week about the cases of the B117 strain that we have identified. That's the UK strain, as it has been referred to. We estimate that roughly 40% of our cases are variant cases. That's a number that we have projected. Hasn't been surprising, but definitely requires our attention and continued focus on being disciplined. We have a group across our COVID response team and at the Rhode Island Department of Health that's focused on our variant response strategy. We're making sure that it's tailored to the different needs and dynamics that are occurring in different parts of the state. In some places of the state, it looks like expanding access to vaccine and doing everything we can to connect eligible people to treatment is what's going to be key to address the cases that we see there. In other parts of the state, it involves ramping up on our testing efforts in the surrounding communities and doing a full court press with mask distribution, making sure that people have the most upgraded mask that they can wear most effectively. There are different age groups, there are different demographics, all of which we want to continue to monitor and laser in on addressing so that we can continue to stay in front of the variant version of this virus. We are absolutely focused on this, and I share that because I want to make sure that you all continue to remain focused right along with us. As the governor said, we don't want to have to slow down the loosening of our restrictions. And we definitely don't want to interfere with our goal and focus on having an incredible summer here in Rhode Island, the way we are looking forward to. The three keys to getting us to that finish line have not changed: testing, treatment, and vaccination. We still have ample amounts of treatment for COVID-19 available in Rhode Island. If you test positive for COVID-19, find out about treatment. See if you're eligible. Talk to your doctor, or if you don't have a doctor, we have doctors who are available for you. Go to covid.ri.gov/treatment or call our info line and ask about getting access to treatment. On testing, please continue to get tested regularly. Make an appointment for a same-day test every week on portal.ri.gov, so it's a normal part of your schedule and a powerful way to continue to protect your household. We're excited that we have a new testing site opening in Woonsocket tomorrow at the Woonsocket Walnut Hill Plaza. This site will be open 7 days a week and will have Binax Now rapid tests as well as the PCR molecular tests for coronavirus. The last thing I want to update on today is our vaccination campaign. As the governor shared, we have made fantastic progress, just as anticipated. We continue to be in the top 5 nationally for the number of people who have received at least one dose, and more than 300,000 people have received at least one dose of vaccine here in Rhode Island. We've administered almost 500,000 doses of vaccine across our state in just these few short months. As you can see on the graph on the screen, our average number of doses administered per day has topped 10,000 doses administered daily. And last week, we administered more than 70,000 doses of vaccine, which is more than we have done in any one week thus far. We are able to ramp up our administration numbers quickly because we have worked hard to build out our infrastructure. We are ready for 100,000 and can even take more in terms of administrations a week. We're excited about the opening of the 2 new vaccination sites that we've shared and have plans to continue expanding capacity based on the assurances we're getting from the federal government about more vaccine coming to Rhode Island. Because we're getting these assurances, we're able to breathe better and feel confident in being more aggressive with our eligibility timeline. As we shared last week, all Rhode Island adults will be eligible to make an appointment to be vaccinated by April 19th. Between now and April 19th, we are going to continue to progressively open eligibility to different age groups, as you can see on the updated timeline now on your screen. We are currently vaccinating people who are 60 to 64 and people who are 16 to 64 with underlying health conditions. The next group to be eligible will be people who are 50 to 59. Our aim is to open eligibility for this group by April 5th. Roughly a week after that, we anticipate opening eligibility to people who are 40 to 49 years of age on April 12th. And then by April 19th, we expect to open eligibility to people who are 16 to 39 years of age. And as you can see, we'll continue vaccinating all those who are above. While not everyone will be able to get an appointment on the first day eligibility opens for their age group, we are confident that most people in each age group will be able to have an appointment within a week or 2 after they become eligible. This is something we consider extremely important and we are really focused on. When I look out over the next several weeks, we really have 3 main tasks before us from a vaccination standpoint. The first is to continue expanding our capacity so we're able to administer vaccine as quickly as it comes into Rhode Island. We're doing a great job on that front, and I'm proud of all the work that the team has put in to get us to such a strong place, and we're going to continue pushing forward from there. The second task is to narrow our disparities and to continue to be laser focused on addressing that directly. We want to make sure that our vaccination rates are as high as possible in all communities throughout the state, particularly in communities where we know the case rate and hospitalization rates have been higher. Vaccination rates need to at least mirror that or be beyond. That includes especially a focus on our communities of color. We know from our data that our communities of color have been hit hardest by COVID-19. We've also understood that it's based on the surrounding environments, the determinants of health, the employment, the access, all of the dynamics that we know contribute to why certain communities are disproportionately impacted compared to others. That's why it's so critical for us to make sure that we're front and center in addressing it. The thing we are keen on is hospitalizations, as I've mentioned. We want to hold ourselves accountable to getting our vaccination rates as high as possible in our communities where we have seen the greatest number of hospitalizations. We have been receiving some very valuable input from our leaders in the Governor's Equity Council. And we're going to keep engaging with them and responding to them and gaining from them their insight on how we can and will do better. We've done a lot of great work with a lot of very dedicated community partners thus far, and we also know that we have much more to do. We are committed to that together. Finally, we're working to make the registration process as customer-friendly and convenient as possible. This approach is unlike anything we've ever done before. We've never taken on a mass vaccination campaign with the demand so high and supply so limited up front and then know that it's dynamic and be able to respond effectively. But we are committed to doing whatever it takes to help ensure that everyone who wants to get vaccinated can and will get vaccinated here in Rhode Island. We know that some people have had a frustrating experience trying to get an appointment and not being able to get one. We're making a change to address that and any other improvements we can make to make the customer service experience as streamlined as possible. We know that this is important, we're focused on it, and we're excited about the progress we're making across the board.